everybody. Welcome to another edition of Doc Talk with Monument Health. I am Mark Houston, and back again. I got to check my records with you guys because this might be a record for you guys being on the most. So there's an award ceremony when we're done here. Yeah. So I don't want you guys to leave right away.
I accept.
It's Dr. Hollan Harper and Dr. Abbie Metzler. They're both primary care sports medicine physicians at Monument Health's Orthopedic and Specialty Hospital right here in Rapid City. Thank you guys for coming back in and talking sports medicine because, well, you guys told me on another podcast that the fall is really your busiest time of year. Mm-hmm. But what sports are we wrapping up in high school right now? We've got is it cross country, I think? Some of that's, no, is that done already?
So cross country's done. We're at the height of kind of the end of basketball season.
Basketball, there we go.
Reaching March Madness, so we're going to start getting the state high school tournaments, the college tournaments, all of that's going to start happening.
Excellent. Yep. All right, so you guys are still busy.
Oh, yeah.
Right?
We're always busy.
Well, let's just get into sports medicine specifically here and kind of its role in preventing and treating sports-related injuries, right? Because there are things that I'm sure coaches teach you when you're on the field and what you should do and whatever, but I think you guys can drill down a little bit more to help these kids and college athletes and professional athletes make sure they get to start and finish a career, correct?
Yeah.
So what kind of role do you guys play in all of this?
And you kind of touched on a lot of it. Really, our job is to kind of prevent it when we see it, and then if things do happen, okay, diagnosing it and treating it, and what does that rehab and what does that return to play process look like? So essentially our job is to return you back to the activity that you're doing, but ensure it's safely, right? And so that's kind of our job, is to sit there, and our job is to keep you on the field, not off, but keeping you on safely.
So how often are you guys actually at the events? Do you guys spend a lot of time at events?
All the time.
Yeah. Do you guys get to pick the ones you want to go to, or are you kind of
I just get
assigned
assigned by Dr. Metzler?
That is kind of my job, yes. I tell him where to go. But
Yes.
no, we do. So we're always on, I know we touched on this previously too, but we're always on college and football sidelines for high school as well, because high injury rates. So you want someone there in case there's a spinal cord injury or something that happens. So we're guaranteed always to be there. Most South Dakota School of Mines basketball games we're at. Then there's also the high school basketball games. That's usually like higher yield games, things like that we're at. We're pretty much all year round. Like I said, the marshals in the springtime. We just kind of run around. Yeah. Rodeos, the stock show just ended. We're at the stock show.
Yeah, MMA fights, boxing events.
Yeah, we have some big ones coming up in April with those.
Yeah, that's I guess thinking of that. We're such a huge rodeo community, obviously, and I would say out of all the sports you guys cover, that football's probably has to be the most dangerous sport, isn't it?
Well, if you take out rodeo.
Yeah, that's what I mean. That's what I was going to say.
In rodeo, if you get an injury, you're dead.
I was going to say in rodeo though, that has to be. I mean, right up there.
But those guys are not like
they're superhuman.
pansies. They're literally like, okay, my arm's falling off. Can you fix it? They will not come to you with a sprain.
Yeah. You don't want people to be tough, right?
No.
You want to, when they have an injury, you want them to be, yes, get in and see me, you maroon, because we got to fix this.
Because we don't want you to have the chronic pain in 20 years.
Yeah, we don't want you to have the scarring and all that. There are things that we can do to help. Yeah. I think there's this misconception of our job is to like pull you out. No, our job is to keep you on, but keeping you on safely. But if that means a 2-week pause so that you can finish out the rest of the year safely, then that might cause that. But, it's just funny because I think that's a misconception, though. Our job is to keep you out there, but keeping you out there safely and also as long as you can possible.
And I will find a way to keep you on the field. Our job is to allow you to enjoy this activity. We're not trying to keep you out. And I think there has been a misconception in the past of, can't see the doctor. I'm going to be pulled out.
Oh, come on.
Yeah.
Do you guys catch some heck about that from certain, I don't know, just players or parents in some instances too?
I would say we used to get it more. It's getting better because I think people truly realize if we catch it early, we can do our job and get you back there really quickly. If you let this go on for weeks and weeks, then we're catching it after it's become a big problem, and then we don't have as many options available to us because you've naturally just funneled it for us without us being able to say, hey, let's modify and do these things to kind of help you along.
Well, that's good.
So I will say it's changing the more our profession is known about. I think it is getting better. And some of those old school mentalities of, just fight through it, I think are going away. We're still fighting it a little bit, but I do think it is getting better.
Well, that's good. You guys must have a pretty big team though. for all of us.
cover
I was going to say, it
lot of
can't just be
teams.
you two.
Yeah,
that
no,
do it.
Dr. Humphreys, one of our orthopedic surgeons, he helps us out a lot. But we each have a high school that's assigned to us, and then we schedule to cover the School of Mines games and the Black Hills State games. So we rotate all the time. So we're just helping each other out
Yeah,
if one of
and
us
then we
can't cover.
Yeah, so we have 2 non-op sports medicines. That's Dr. Harper and myself. And then we have 2 surgical sports medicine, and that's Dr. Jensen and Dr. Humphreys. Dr. Jensen does more of our northern hills, so Black Hills State and the schools up there. And then Dr. Humphreys does down here. I kind of float all over, and then Harper's mostly down here as well.
Well, you guys must have got into this because of a love of sport somehow, didn't you? I mean,
Yeah. I mean, the love of sport and the love of movement. Like
Yeah.
I call it cheesy medicine because I get to just make you feel better.
Right.
I get to go do the happy stuff. I don't have to tell you bad news. I don't have to. Sometimes I have to
that's-
tell you bad
well,
news, but it's
sure.
usually not life-threatening.
yeah.
Well, and we're supposed to remain very objective when we're on the sideline. But I mean, I've been covering these sports for years, so it's so hard not to cheer.
Well, how can you not? Come on, you
So
guys
if you see me out there cheering for Mines, it's not,
Well, what's great about that statement is you're doing something locally.
Yeah.
Monument is local. You guys are local,
Yeah.
and that's what you're doing. So yeah, I would hope in a way that I'd see you guys clapping, below the whatever. So nobody
But
saw
I
you.
would say the one piece we didn't. The true heroes of all this are our athletic trainers.
Sure.
They are at all of your high schools, at all of our colleges. Monument supplies them to all those areas, and I think truly like there are eyes in our ears because we, like you said, there's only 4 of us,
Yeah.
and so we can't be everywhere. And they are the people that know these athletes the best. They're the ones who really know them, and I think it's really like I can see something and then I can kind of ask like what's been going on. I can get a whole background story that I normally don't get.
That's just what I was going to ask. Kind of how your relationship works then with these players. So that kind of sums that up more or less.
Yeah, I would say with these players, we see for our colleges, we're running training rooms and things like that so we do see them if they need it, once to twice a week. But our athletic trainers are the ones who are there every day with them.
Okay.
Yeah.
Well, let's ask. I think the big question then with you two here, and when we get ready for more sports heading into the summer and the fall, and parents and students next year getting ready to get their kids into sports, right? What can they expect at a sports physical? And this will kind of lead into the next question here too. But what can they expect when their kid is getting ready to play football this fall and they come to you guys?
Yeah, so obviously a sports physical is not a significantly in-depth, blood draw, and we're going to look at every medical health condition you've ever had. There's some basic questionnaires that we go through to just tip us off if there's any heart-related issues or lung issues or things that would require you to really exert yourself that might put you at risk. But then we do a full musculoskeletal exam, make sure all your joints work, and make sure that after you've potentially had some type of injury that you're fully recovered and you're ready to go.
And you should time that with like your normal physical too, shouldn't you? I mean, should they kind of go hand in hand, or is that necessary?
It depends on what the timing of your last one was.
Okay.
But, so like your well child checks, that's always really important to do. Those are going to be your really in-depth, ensuring your growth is growing appropriate. They're going to be following your charts, looking at your labs, ensuring your vaccines are up to date. The ones that we're doing are the ones that we do before each season to ensure kind of at the beginning of each year for the rest of the sports season, I should say, is making sure, like Dr. Harper said, we're looking at just ensuring your safety on the field. That's what a sports physical is for. So that's why it's super important when we go through the history and stuff on there that everything's on, if there's familial, like cardiac issues, we want to know about that because then we can do a few tests to then still ensure your safety, right? It's not that we're going to say, oh, absolutely not. Just, hey, let's do a couple extra things to make sure you're safe, but you still need to do that well child check totally separately from this. And that's going to be kind of the all-encompassing one and they're going to pull up all your records from previous. Yeah.
Well, I guess that answers my next
Yep.
question then. You
Yep.
guys rolled into that just perfectly. Nice job. So what sport in particular do you guys like? I mean, what's your favorite sport if you had to pick one?
Favorite sport?
Yeah, your favorite one.
To watch or to cover, I think.
Okay, that's a good question though.
Yeah.
If you this is your at-home doctor's uniform is off. What are you doing?
I'm watching football.
Okay. Yeah. All right. Is there different challenges then, obviously, in different sports, or is it
Yep.
kind of all because the bodies, I'm assuming, move in different ways in different sports,
100%.
right? So
there are very different injuries depending on the sport. You think about your softball, you're getting your shoulder, softball, baseball, your shoulder injuries are really common. Your catchers in those sports, it's your hips. When you think about football, depending on the position, it's different.
Yeah.
Right? Your O-line's going to have different stuff than your quarterback's going to have. So really half of our job, or a lot of our job, I should say, is trying to think what could go wrong.
Right.
Right. I've worked a professional pole vaulting event. Okay, what could happen here? You're just rodeo. Okay,
Shudder
the
to think.
chutes.
Yeah,
You're
right.
thinking more crush type injuries with rodeo. You're kind of walking through each of those and saying, how do I prepare myself best? Because if something does happen and I have to go out there, what am I looking at and what am I doing?
Okay. So that's so then which one do you like to cover? Which is your favorite to cover then?
I really like covering MMA and boxing.
Yeah.
Oh, do you really?
Yeah, I
that's
really do.
How do you, the thing with that sport, it literally is just pure violence, right? So
and
it's
ethically,
controlled,
it
though.
kind
Right,
of
of
contradicts what we
Yeah,
are as
right.
doctors. But honestly, it's the times that I've been the most busy and where I feel like I'm using my skill set the most are during those events.
Yeah.
Where you got to
you
suture
have
somebody
to.
up, or you got to make sure that they're breathing okay.
Yeah.
You got to make sure that this arm bar is going to snap their elbow, and then
Oh my God.
So those are just kind of like, it's a little bit more exhilarating because that anticipation of what could go wrong. Well, everything could go wrong here.
Yeah.
So.
Okay. All right. You said something else that led me to another question I want to ask. I love this right now. So let's take a position in a sport specifically. Is there anything on the top of your mind that's the most dangerous position to play? And
The punt returner.
well, you said, because I always am amazed that I don't follow them after their careers are done, but catchers in baseball specifically, I'm so surprised that they can literally walk after a career doing that in baseball because of that position.
It's a lot of, and that's a lot of it is what you're doing now does affect you later. So we do see a lot of chronic hip issues and knee issues in those types of athletes later. But you also see a ton of labral issues in the pitchers years later too. It's that chronic overuse type stuff. That's why, not to plug this, but when you're younger, we want you playing multiple sports because if you only play one by the time you're actually at an elite level, your body's burnt out and it's tired. And so that's what we see a lot of is just there's very certain injuries that just show up, your soccer players, it's your hip flexors. We see that because when you play soccer year round, that's going to be the thing that goes. So we just kind of find what's the weakest link, and that's going to be the thing you're probably going to have problems with if you don't take a break or don't switch up sports.
Oh, that's really interesting.
And that's the same thing with what you're doing in the community as well. If you have a job that requires the same movement over and over and over again, whether that be typing or roofing or kneeling or concrete work, you'll come in with a very specific injury that if you are not careful of will become a chronic issue.
Like COVID's the perfect example for a lot of people because they had to start doing things that they hadn't done before. So our college swimmers started running. Well, their bones weren't ready for that, so we saw a bunch of stress fractures. Everyone went home and was stuck at home, working from home, so everyone started home improvement projects. So we were seeing a lot of lateral epicondylitis and shoulders because everyone's twisting and cranking on stuff in their house.
They don't do that.
And so it's just all of a sudden these overuse things started popping up because COVID forced people to use their body differently.
Oh my God.
So that's just kind of the things we also think down the road. That same stuff's happening. You're just not seeing it as on big of a scale. It just put it in a nice line for us to be like, okay, that's a problem.
All I thought about when he said that was, God, we are just fragile bags of meat, aren't we? We can't fix a refrigerator or
You're dying right now.
No, you just gotta do things gradually. I think it's our culture and it's our way of life where we go 0 to hero. That's just very much ingrained in us. Just do things in stages and you're fine.
and as you mature, you have to adjust your activity because usually when you're young, you want the biggest, strongest muscles you can think of.
Of course.
Yeah.
But as you get more mature, you need to transition from I have to have the largest biceps to I need to have the most compliant tendons.
Yes.
And you don't really see people at the YMCA be like, I'm working my tendons.
Look at that.
Yeah.
Look at
See
this
the tendons
tendon.
in this bad boy. Look at that.
But if those are very compliant, then they're going to be great for
I need to be able to touch
longevity
my
here.
shoe when I'm 80. Yeah, like that's
You know,
should be our goals.
the only thinking of what I've done for a living my entire life, I can kind of counter all of these repetitive motions that you guys have. I have literally not shut up in like 35 years. I don't have TMJ or anything. I'm fine, you guys. I don't, this repetitive motion works just fine. Okay. You guys, thank you very much. Dr. Abbie Metzler and Dr. Hollan Harper, you're both primary care sports medicine physicians at Monument Health, Orthopedic and Specialty. You guys are open invitation to come back anytime and talk about why my tendons aren't bigger. Thank you very much.
Thank
Thank
you.
you.